Welcome back, ladies and gentlemen. It is truly a pleasure to see you again, to have another opportunity for us to sit together, to exchange thoughts, and to share stories related to health, related to medicine, and directly related to the everyday lives of each and every family. This morning, the topic that has been raised for discussion is dementia. Greetings to all of you who are following the program on this Saturday morning. I wish you a weekend that is truly joyful, full of positive energy, and one in which you are able to accomplish many meaningful things for yourselves as well as for your families. Today's conversation is conducted with the hope of sharing basic medical knowledge related to a disease that we are very likely to encounter as we enter older adulthood and later stages of life. This is a condition that many people still tend to believe is simply something that comes with age, something that naturally happens when people get old. But in reality, it is far more complicated than that. The year 2023 was a year closely associated with the emergence of a series of groundbreaking achievements around the world. There were achievements related to technology. There were achievements related to medicine. People talked about artificial intelligence. People talked about artificial foods. People talked about gene editing therapies. And in the field of medicine, for the first time in 20 years, the United States Food and Drug Administration fully approved a drug for the treatment of dementia. Dementia is considered to be a disease that may become a pandemic of the 21st century. According to the World Health Organization, there are currently approximately 55 million people living with this condition worldwide. Every 3 seconds, a new case is recorded. Each year, approximately 4.6 million new cases are diagnosed. According to projections, this number will double every 20 years, reaching more than 80 million cases by the year 2040, and by the year 2050, it may rise to as many as 150 million people. Also, according to the World Health Organization, dementia is currently the 5th leading cause of death. In the United States alone, statistics show that out of every 3 elderly people who die, 1 death is related to dementia. This accounts for more than 50% of the disease burden caused by neurological disorders among older adults, and the actual number is believed to be significantly higher. Even more concerning is the fact that dementia is showing a clear trend toward younger onset. There have been cases diagnosed in people in their 20s. The youngest patient ever recorded was only 17 years old. It can be said that this is a devastating disease that is silently spreading across the globe. This disease directly affects the lives of millions of people. It poses enormous challenges not only for the individual patient, but also for families and for society as a whole. This is a neurodegenerative disease. It is characterized by memory loss, a decline in cognitive function, and a gradual loss of independence in daily activities. It is one of the most serious public health crises of our time. The numbers that have just been mentioned are truly alarming. However, if we set the statistics aside for a moment, we must first recognize that dementia is, above all, a human disease. It affects each individual patient. It affects each family. And it affects every member of the family in a very personal and deeply painful way. Perhaps every one of us has had personal memories or has heard stories related to relatives or friends connected to this disease. For that reason, in order to gain a deeper understanding of dementia, and in order to adopt preventive measures for ourselves and for each member of our families, today's conversation is being conducted. And the first question that naturally arises is this: what is dementia, and how dangerous is this disease? In fact, if we look back at everything that has been presented so far, that question has already been answered. Because we can clearly see that very few people truly pay attention to dementia. Even the terms dementia or Alzheimer's themselves are medical terms. And once something is framed as a medical term, many people feel that it is distant and unfamiliar. In everyday life, people do not use these terms. They simply say, in a very colloquial way, that someone is confused or forgetful. And confusion is commonly associated with old age. Therefore, many people assume that it is normal. They believe that aging naturally brings confusion. They believe that reaching a certain age inevitably leads to forgetfulness. Because of this way of thinking, people rarely consider whether this is actually a disease. They are even less concerned with prevention. But now, we can see that confusion and memory loss are no longer limited to the elderly. Even young people can be affected. As mentioned earlier, this disease is gradually affecting younger individuals. There have been patients in their 20s. The youngest patient ever recorded was 17 years old. That patient was in China. It was discovered that the disease progressed very rapidly and very severely. This observation suggests that the more developed a society becomes, the more diseases of modern life emerge. There are diseases that were once thought to belong exclusively to the elderly, but that is no longer the case. So how dangerous is dementia? Simply looking at the statistics mentioned earlier already gives us some sense of its severity. But if we look a bit deeper, we will notice another issue. Those statistics still do not fully reflect reality. Does anyone report to authorities that a family member is becoming confused? No. Does anyone take their loved one to a hospital or report the condition to doctors for the sake of complete statistical recording? Almost never. Therefore, we do not have truly accurate figures. Even in many other countries, especially developing nations, statistical data remain incomplete. The countries that tend to do well in data collection are developed countries. For example, the United States. For example, Japan. For example, South Korea. And more recently, China. In China, within a very short period of time, once serious and systematic data collection began, the number of dementia cases increased manifold. This indicates that a large number of cases had previously gone undetected. Now, let us imagine a very concrete situation. Suppose that in a family one day, the husband goes out onto the street and forgets to bring his keys, or he goes to work and forgets to bring an item with him. At first, these instances of forgetting are very small. People usually overlook them. After that, the person begins to forget more often. He forgets where the kitchen is. He forgets where the bathroom is, even inside his own home. Then gradually, the forgetfulness becomes more serious. There are people who can no longer remember who their children are. When their children come to ask questions or talk to them, they do not recognize them. They do not know whether that person is their son or their daughter. There are even cases in which the patient no longer remembers who their spouse is. One day, a husband turns to his wife and says, "I do not know you." Just hearing this alone, we already feel how horrifying this is. Usually, people simply blame old age, but deep inside the patient themselves, there is also great sadness. And deep inside the family members around them, there is also tremendous tension and distress. This disease spares no one. It does not distinguish between ordinary people and famous individuals. There are many famous people around the world whom we know have suffered from this disease. There are great writers. There are national leaders. There are people who were once very sharp-minded and exceptionally intelligent. But when the disease appears, they gradually lose their memory. There are cases in which, after leaving office, during a public speech, a person forgets what they have just said. In the middle of the speech, they can no longer remember the earlier part. Later, after seeking medical evaluation, it is discovered that they have developed dementia. Then the disease progresses very quickly, to the point where they read one sentence and forget the sentence before it. By the time they reach the final word, they have already forgotten 2/3 of the words that came before. Eventually, they are no longer able to read at all. There are other cases in which, within a very short period of time, the patient can no longer remember who their spouse is. They can no longer take care of themselves. All daily activities become completely dependent on others. From personal hygiene to the most basic daily tasks, everything requires assistance. The key point that needs to be emphasized here is this. If we do not understand this disease, if we do not have preventive measures, if we do not intervene in time, then the price we must pay is extremely high. So what exactly is dementia? In reality, to fully explain what dementia or Alzheimer's disease is would require a great deal of time and a very thorough presentation. However, it can be summarized in the following way. At present, there are 3 main theories that attempt to explain why this disease develops. The first theory relates to protein plaques in the brain. These plaques appear in different regions of the brain, but the 2 areas most commonly affected are the hippocampus and the cerebral cortex. The hippocampus and the cerebral cortex are regions that are directly related to memory, especially long-term memories. Therefore, when these regions are damaged, the first sign we observe is frequent forgetfulness. Second, the cerebral cortex is also directly related to thinking. When the cerebral cortex undergoes atrophy and degeneration, and when the neurons in the cortex are destroyed, a person's thinking ability declines. Once thinking ability declines, the inevitable consequence is that behavior and daily actions in everyday life also deteriorate. The first theory states that amyloid plaques, which are a type of protein, attach to the surface of nerve cells. This attachment triggers a very strong inflammatory response, and it is this inflammatory reaction that damages nerve cells. The second theory is related to an intracellular protein known as tau protein. Under normal conditions, this protein exists in very small amounts inside cells. However, due to a process known as phosphorylation, tau protein increases abnormally. This abnormal increase triggers an inflammatory response inside nerve cells. That inflammatory response then leads to the destruction of nerve cells. The third theory involves the acetylcholine system, also known as the cholinergic neurotransmitter system. This system produces chemical mediators, and these substances are highly toxic to nerve cells. They damage nerve cells and cause them to die. Thus, it can be seen that although these three mechanisms are different, they all lead to the same result. That result is damage to brain cells. These injuries initially concentrate in regions related to memory. Later, they spread to other regions, including motor areas. From there, they give rise to many different clinical manifestations. Therefore, the hope behind this conversation is that through this discussion, each person will pay greater attention to dementia, also known as memory decline or confusion, and will stop assuming that this is merely a natural degenerative process of aging that everyone must eventually experience. That is a very mistaken belief. If we understand this disease correctly, we will have better mental health. And when mental health is good, it has a profound impact on physical health as well as on longevity. From a personal perspective, dementia is a disease that is very close to many people. The stories associated with this disease are not distant or abstract. They appear directly in everyday life, within our own families, neighbors, and friends. Even within families, there are elderly individuals, nearing 80 years of age, who begin to show signs of confusion. Sometimes, family members see them climbing onto the dining table. When asked where they are going or what they are doing, the response they give is, "I am going to sleep." Being unable to distinguish between a dining table and a bed causes deep concern for loved ones. At other times, when intending to go to their own room to sleep, they mistakenly enter another person's room in the house. Such mistakes happen repeatedly. There are other stories from close neighbors. Some people who were once very gentle, neat, and careful in their daily routines. But one day, after taking a bath, they put on their shirt properly, then come out to sit and eat with their children and grandchildren, while forgetting to put on trousers. The children may feel amused, but at the same time, they feel very worried, because in the past, that person lived in a very orderly and careful manner. Even among younger people, there are signs that seem very ordinary. Sometimes forgetting keys, sometimes forgetting a phone, sometimes placing the phone in one's pocket or glasses on one's head, yet still searching everywhere for them. Stories like these happen very frequently. There are times when parents take their child to get vaccinated and feel mentally sluggish, forgetting things back and forth. Some people even arrive at the vaccination center, but forget to bring the child with them. Only when a family member calls do they suddenly realize what has happened. Everyday stories like these make us realize that dementia is not far away. It exists right around us. According to common understanding, diagnosing whether a person has dementia is actually not very difficult. However, the problem lies in the fact that many people still believe this is simply a disease of aging, something that cannot be treated. Because of that belief, the prevailing attitude is acceptance. It is to ignore the problem. It is to not take loved ones to the hospital for evaluation. Even when individuals themselves experience forgetfulness, they often reassure themselves by saying that it is just a goldfish brain, just fatigue, just something normal. Very few people think about going to see a doctor. There are also many families who, when they notice that their parents are becoming confused, do not take them to the hospital. They believe it is an inevitable consequence of old age. And because there is no early screening, no early detection, and no timely intervention, many patients end up living in a state of confusion for a prolonged period, lasting until death. In some cases, death occurs due to accidents that are directly related to that confusion. So the question that arises is this: what exactly are the clinical manifestations of dementia, and how does modern medicine diagnose this disease so that each person can have a clearer picture and no longer underestimate it? We often think that confusion, as described earlier, is a normal part of aging. But in reality, those very situations are classic manifestations of dementia. In daily medical practice, such situations are encountered very frequently. There are cases where patients finish an examination, are asked to step outside to wait for results, but then say that they do not know the way out. There is a door right in front of them, yet they say they have forgotten. They cannot remember. They do not know how to walk out. We often overlook details like this and assume it is just ordinary confusion. But the consequences can be extremely serious. There are cases within families where elderly individuals are confused at home. Family members think they can still manage the situation, so they do not pay close attention. At some point, the person walks out into the garden, wanders into the chicken coop area, and then circles around there, unable to find the way back. They fall and no one knows. By the time family members discover what has happened, it is already too late. Here, it must be clearly stated that dementia does not directly cause death. However, it indirectly creates many dangerous situations that lead to death. That is precisely why in the United States, statistics show that out of every 3 deaths, 1 is related to dementia. This stems from accidents and incidents that occur as a result of confusion, loss of behavioral control, and inability to manage daily activities. Given these characteristics, we need to clearly understand how dementia manifests, from clinical symptoms to diagnostic and treatment methods. This is because public awareness remains low, and many people still consider the issue unimportant. As a result, early medical evaluation and diagnosis are rare. If we organize the information clearly, the manifestations of dementia can be divided into 3 main groups of disorders. The first group consists of cognitive impairment. This is the earliest and most common manifestation. Patients begin by forgetting very small things in daily life. They forget their keys. They forget personal items. They forget everyday objects. Later, they forget doorways. They forget where the bathroom is. They forget where the kitchen is. Gradually, the degree of forgetfulness increases. They begin to forget more distant memories. They forget the names of their children. They forget the names of relatives. They forget familiar events. There are cases in which patients are asked very simple questions, such as what day it is today or what holiday it is, but they cannot answer. Some people cannot even remember their own birthday. At a more advanced level of cognitive impairment, thinking ability is lost. Patients no longer think logically. They are unable to perceive or process problems. They cannot control conversations or situations unfolding around them. Gradually, they lose the ability to think in both work and daily life. The second group of disorders involves psychiatric symptoms. Patients may experience very noticeable emotional changes. Some become irritable, agitated, and easily upset. Some fall into depression. Depression can be both a manifestation of dementia and a factor that accelerates disease progression. In addition, there are symptoms such as anxiety, suspicion, groundless jealousy, selfishness, hoarding behavior, and childlike conduct. All of these belong to the group of psychiatric disorders seen in dementia. The third group of disorders involves impairment of daily activities. Patients gradually lose the ability to work. They lose the ability to walk steadily. They lose the ability to perform even the simplest tasks. They can no longer take care of themselves. They do not know what to do or how to do it. They become weak and completely dependent on others. These 3 groups of disorders constitute the core clinical manifestations that allow us to recognize dementia in everyday life. From a medical diagnostic perspective, in addition to the clinical manifestations described above, there are more specialized diagnostic methods. First, there are psychological tests and neurological, psychiatric, and neuropsychological examinations. These tests help assess cognitive function, memory thinking ability, as well as behavioral and emotional disturbances. In addition, there are paraclinical tests. These include blood tests and urine tests. As mentioned earlier, two proteins are frequently discussed in dementia: amyloid protein and tau protein. Through testing, it is possible to detect the presence of these proteins or changes in their concentrations in blood or urine, thereby supporting diagnosis. Furthermore, it is now possible to test for biomarkers of central nervous system degeneration. For example, astrocytes in glial cells. When these cells are damaged or die, they produce characteristic chemical mediators and proteins. These substances can be measured qualitatively or quantitatively in blood, urine, and in some cases, even detected in stool samples. Another diagnostic approach involves genetic testing. There are cases of dementia that are related to hereditary factors. Certain genes, especially those involved in amyloid protein metabolism, may undergo mutations and be passed from one generation to the next. When a genetic cause is suspected, genetic testing can be performed to support diagnosis. Alongside biological testing, imaging studies play a very important and practical role in clinical practice. Commonly used methods include magnetic resonance imaging, computed tomography, and in some cases, PET/CT. With MRI, signs of white matter degeneration and brain atrophy are often observed, particularly in regions related to thinking and memory. In practice, there are imaging findings that many people tend to overlook, yet they are extremely important. One such finding is brain atrophy. Many people believe that brain atrophy is a normal part of aging and therefore do not pay attention to it. However, brain atrophy is a very important sign. It alters intracranial pressure. It disrupts the environment in which neurons function, and it accelerates the progression of dementia. On MRI or CT scans, cortical atrophy can be observed, especially in the frontal and temporal lobes. These two lobes are heavily involved in thinking, memory, and behavior. When interpreting imaging studies, these signs must be carefully noted because they play a major role in guiding diagnosis. For this reason, accurately diagnosing whether a person has dementia is extremely important. A correct diagnosis allows physicians and families to establish appropriate treatment and monitoring strategies, thereby slowing disease progression and reducing the heavy consequences for both patients and their families. Another issue that many people are deeply concerned about is medication for the treatment of dementia. As mentioned earlier, a new drug was approved by the United States Food and Drug Administration in the year 2023. This was a major milestone in the field of medicine. For more than 20 years, the global medical community had made tremendous efforts to research treatments for dementia, yet most attempts ended in failure. This drug was initially approved in early 2023 and later that year received full approval. When reviewing the list of major global events that year, it was noted that among the top 10 most significant events, 3 were directly related to medicine. The first was artificial intelligence, the second was gene editing technology, and the third was the approval of a drug for the treatment of dementia. The fact that a dementia treatment drug was ranked alongside such major technological breakthroughs reflects the immense level of global attention and expectation surrounding this disease. The United States Food and Drug Administration is regarded worldwide as a very strong regulatory authority. When a drug is approved by this agency, nearly all countries around the world carefully review and consider that decision. Therefore, the approval of this drug generated great hope, not only within the medical community, but also throughout society at large. However, when viewed carefully and based on the published scientific studies, it must be clearly stated that this drug is not a cure for dementia. Based on personal evaluation of the research, the drug primarily works by slowing disease progression. It slows the decline of memory and cognitive function. It does not reverse or fully restore damage that has already occurred. It is important to remember that over the past 20 years, Hundreds, even thousands of drugs have been researched, published, and tested with the hope of treating dementia. In the end, nearly all failed to deliver the desired results. For that reason, the current approval of a dementia drug is a positive signal. But expectations should not be excessive. At present, dementia medications are considered a last-line intervention. They are used only after the disease has already manifested. Moreover, treatment costs are very high, and real-world effectiveness still requires long-term observation and evaluation. The most important approach remains a correct understanding of the disease, understanding it in order to prevent it early, understanding it in order to change lifestyle, understanding it so that if the disease does occur, its progression can be slowed rather than allowed to advance rapidly and exact a devastating cost on life. In recent years, research has increasingly shown that dementia is a multifactorial and highly complex disease. There are factors that cannot be controlled. For example, age, sex, family history, and the presence of specific genetic traits related to certain proteins. These factors cannot be changed and therefore will not be discussed in depth here. However, alongside them are many other risk factors that can be controlled. Among these, vascular-related factors are among the most important. When discussing vascular factors, the concept can be understood very simply. The heart's function is to pump blood to the brain in order to deliver oxygen and nutrients to nerve cells. If for any reason blood flow to the brain is reduced, or if blood vessels are damaged, the brain will suffer from oxygen and nutrient deprivation. This condition strongly promotes the development and progression of dementia. All causes that reduce cerebral blood flow and all causes that damage cerebral blood vessels can contribute to dementia. At the top of these risk factors is hypertension. Hypertension often coexists with dyslipidemia and diabetes, forming a cluster of metabolic disorders. When blood pressure is elevated, vessel walls become stiff and atherosclerotic, and the vessel lumen narrows. Normally, blood vessels must be elastic in order to efficiently deliver blood to the brain. When vessels become stiff and narrowed, cerebral blood flow decreases. Blood cells have greater difficulty delivering oxygen to brain tissue. As a result, the brain enters a state of chronic oxygen deprivation. This condition strongly accelerates the development of dementia. Large-scale studies have shown that hypertension is an independent risk factor for dementia. This means that hypertension alone, even without other accompanying conditions, is sufficient to increase the risk of dementia. In addition to systolic blood pressure, diastolic blood pressure is also extremely important. If diastolic pressure is too low, below 70 millimeters of mercury, the ability to pump blood to the brain is reduced. This too increases the risk of dementia. Therefore, attention must be paid to both values, not only abnormally high blood pressure, but also abnormally low blood pressure. Regarding blood lipids, elevated cholesterol and triglycerides adhere to vessel walls, causing atherosclerosis and narrowing of blood vessels. At the same time, high lipid levels increase blood viscosity, slowing blood circulation. Both of these factors reduce the supply of blood and oxygen to the brain. When the brain experiences prolonged oxygen deprivation, nerve cells are damaged and die, increasing the risk of dementia. For this reason, lipid levels must be tightly controlled through diet, physical activity, and medication when necessary. Diabetes is also a very important risk factor. Chronic hyperglycemia damages blood vessels, increases the risk of stroke, and reduces the brain's ability to nourish nerve cells. People with poorly controlled diabetes have a much higher risk of developing dementia, and the disease progresses more rapidly. Therefore, controlling blood glucose, particularly through monitoring A1C, is critically important in dementia prevention. In addition to metabolic factors, overweight and obesity also increase risk. Studies show that as body mass index rises, the risk of dementia increases accordingly. This demonstrates that weight control is important not only for cardiovascular health, but also for brain health. Alcohol and tobacco are additional factors that cannot be ignored. Smoking produces numerous oxidative substances that severely damage central nervous system neurons. Alcohol, especially when abused, causes brain atrophy, particularly in the frontal and temporal lobes, areas directly related to thinking and memory. People who abuse alcohol often show clear cognitive decline both clinically and on imaging studies. Another increasingly concerning factor is the use of stimulants and illicit drugs, especially among younger individuals. These substances severely damage neurons and are one of the reasons dementia is appearing at younger ages. If these factors are not controlled, they interact and compound one another, rapidly increasing both the risk and speed of disease progression. In addition to the vascular and metabolic factors that have just been discussed, there is another group of factors that is also extremely important. These are psychosocial factors. This group includes level of education. It includes depressive states. It includes sleep disorders. And it includes many other related elements. All of these factors have a very close relationship with dementia. It has been observed that dementia occurs more frequently among people with lower levels of education. Individuals who have had limited access to education, fewer opportunities for learning, and less cognitive stimulation in daily life have a higher risk of developing dementia. In reality, in communities where intellectual activity is limited, the prevalence of dementia tends to be higher. Conversely, among people who regularly engage in cognitive activities, people whose work requires thinking, learning, and problem solving, the risk of dementia is lower. Within academic and scientific communities, the number of people who develop dementia is relatively small. There are individuals who remain mentally sharp well into their 90s. This is not a coincidence. It is the result of a lifelong process of continuous cognitive training. Therefore, what needs to be emphasized here is that human beings must continuously train their minds, especially in older age. This becomes even more important. This can take many forms: teaching grandchildren, doing math exercises together, practicing problem solving, trying to recall past events, taking notes, reading books and newspapers. All of these activities help keep the brain stimulated and active. Many people dislike reading long articles. They avoid content that requires sustained attention and deep thinking. They prefer short, simple, easy-to-consume information. However, in reality, such content does not challenge the brain to think. In many parts of the world, people are willing to pay to read long, knowledge-rich articles. They understand that reading and thinking are essential ways to train the mind. Learning, thinking, and analysis do not serve work alone. They directly serve brain health. The brain is like a muscle. If it is not used, it becomes weak. If it is not trained, it degenerates more quickly. Another extremely important factor is depression. Depression can be both a cause of dementia and a consequence of dementia. These two conditions interact with each other. They reinforce each other. They accelerate disease progression together. In reality, the prevalence of depression in the community is very high. Yet many people do not recognize it, or they do not consider it a condition that deserves proper attention. In daily life, people face many pressures, anxieties, frustrations, and stresses. If these negative emotions are not released, if stress is allowed to persist for long periods, mental health deteriorates. And when mental health deteriorates, brain health is directly affected. Therefore, it is necessary to learn how to balance life, to seek out positive experiences, to limit negative influences, especially sources of information that provoke prolonged stress, anger, or anxiety. Sleep is another critically important factor. Just one night of poor sleep can significantly reduce concentration and memory the following day. Experiencing forgetfulness after a sleepless night is not uncommon. If sleep deprivation becomes chronic, it severely affects brain function and increases the risk of dementia. Managing sleep is not simple, but it is entirely possible if approached correctly. Light exposure, sound, daily routines, methods of relaxation before sleep. All of these influence sleep quality. When sleep is adequate, the brain has the opportunity to recover and function more effectively. Therefore, when viewed as a whole, if we can control psychosocial factors such as education, cognitive activity, depression, and sleep, we can make a very significant contribution to preventing dementia and slowing its progression. To control these factors, What is most important is that each individual has a clear plan for daily life, a plan to train the mind, a plan to balance work and life, a plan to manage the risk factors that have been discussed throughout this conversation, including blood pressure, blood lipids, diabetes, body weight, alcohol, smoking, as well as psychosocial factors. When these factors are well controlled, mental clarity improves, and the risk of dementia decreases substantially. Before concluding, one final point must be emphasized. Each person should pay close attention to their own mental health in a comprehensive, structured, and scientific manner. It is important to remember that September 21st is recognized as World Alzheimer's Day. This underscores that dementia is not a minor illness. It is not an issue that affects only a few individuals. It is a global public health problem that deserves serious attention. If we fail to pay attention, fail to prevent, and fail to intervene early, we will pay a very heavy price, just as has been illustrated throughout this entire discussion. On the other hand, if we understand the disease correctly, act appropriately, and start early, we can achieve a better quality of life, greater mental clarity, and a healthier lifespan. There is a very simple but very accurate reminder. Take care of your hair while you still have hair. Brush your teeth while you still have teeth. And take care of your health while you still have strength. In the same way, pay attention to cognitive health while your mind is still clear. While you still have the ability to organize your life. And while you still have the capacity to adjust the risk factors that have been discussed. This concludes today's discussion on dementia. It is hoped that what has been shared will help each person view this issue more seriously, more personally, and more proactively, and take steps to protect memory and cognitive function for themselves and for their loved ones.